Hello, I'm Dr. Steve Tashiro. Are you frustrated and scared because of your shoulder condition? Are you bummed out because your shoulder condition interferes with activities with loved ones, with your recreation and your work? Are you tired of masking symptoms with drugs? And are you concerned and worried about surgery? If so, take heart. I'm here to share with you information about a highly effective, non-drug, non-surgical treatment for shoulder pain. First, I want to share a bit about my background. I've worked in healthcare now for over 40 years, and I've practiced in Lakewood for 17 years. I graduated from Palmer West College of Chiropractic in 1998, and since then, I've taken extensive training in functional neurology, applied kinesiology, which is the study of muscles and movement, and nutrition. And all of these topics come to play when treating shoulder conditions. Let's discuss the shoulder joint. The shoulder joint is the most complex joint in the body. It's actually a combination of 5 individual joints. There are 20 muscles that are directly or indirectly involved in shoulder movement. Let's talk about the rotator cuff. So that's the part of the shoulder joint that people are most familiar with. The rotator cuff refers to the 4 primary shoulder muscles and their tendons. The tendon is where the muscle attaches to the bone. The purpose of the rotator cuff is to attach the humerus or the arm, upper arm, to the scapula or shoulder blade. The tendons of the rotator cuff muscles form an apron or a cuff that adds to stability of the joint, and the muscles are what moves the joint. Now we use an acronym, SITS, S-I-T-S, to denote the names of these 4 muscles of the rotator cuff, and I'm going to draw them for you. So here we have the bones of the shoulder. This is the sternum or breastbone, clavicle or collarbone. This is the scapula or shoulder blade. This is the upper arm, the humerus, where it attaches into the scapula. The S of SITS stands for subscapularis. The subscapularis originates on the front surface of the scapula, and then it attaches to the inside of the upper arm. Now, because of the attachment and origin position of the subscapularis, when it contracts, it performs this motion. We call that internal rotation. The subscapularis is also involved in this motion. That's another form of internal rotation. So you could tell the subscapularis is very involved in throwing motions, like throwing a ball, as in if you're a pitcher. So that's the subscapularis. Now we're looking at the back of the right shoulder. This is the spinal column. This is the back side of the scapula. And again, this is the humerus or the upper arm. The I of sit stands for the infraspinatus muscle. So it originates on the lower half of the back side of the scapula, and it inserts onto the upper back side of the humerus. When the infraspinatus contracts, it performs this motion, like if you're taking an oath, or also if you're reaching behind you, like you're driving and you want to get something out of the back seat. That's the infraspinatus. The T of sit stands for teres minor. That originates on the lower surface of the scapula, and also it inserts on the backside of the upper humerus. When the teres minor contracts, it performs this motion. We call this external rotation, and this is a motion that would be involved in performing a backswing in tennis, for example. That's a teres minor. The S of sit stands for the supraspinatus, and that originates on the top half of the scapula, and it inserts on the top of the humerus. When the supraspinatus contracts, it performs this motion. Raising the arm, we call that abduction. The supraspinatus is especially involved in the first 10 or 15 degrees of this motion. So those are the 4 sits muscles. And their tendons, again, form the rotator cuff. So again, that's an apron or a cuff that adds stability to the shoulder joint. But here's a very important fact. Most shoulder conditions, with the exception of acute injury, develop because of muscle imbalance leading to joint misalignment. If the joint is out of alignment, anytime it's used, that creates excessive wear and tear in the joint structures, leading to inflammation, pain, and eventually degeneration, as in arthritis. Let me show you what I mean. When I perform this motion, the muscles on the top are contracting, the muscles underneath are releasing or lengthening. If the muscles are performing in a symmetrical fashion, then we have smooth, uncomplicated joint motion. But if the muscles that should be releasing are contracting, and if the muscles that should be contracting are weak, instead of smooth movement, we get a ratchety movement. Now, I'm exaggerating, but you get the point. So this exaggerated lack of symmetrical motion is what creates wear and tear on the structures of the joint and causes inflammation, pain, and restriction. A good analogy would be your car. If the front end of your car is out of alignment, when you drive it, the tires are going to wear out faster. You can keep replacing the tires, but they're going to keep wearing out until you correct a problem of poor alignment. And in terms of the shoulder joint, the poor alignment of the bony structures is secondary to muscle asymmetry. So in order to help your shoulder condition, we have to improve muscle symmetry or muscle balance. And how do we go about doing this? It's very common for me to meet people who have been through physical therapy where they have worked to strengthen certain muscles and stretch other muscles. But still, after months of doing this, muscles are still weak and short. And this is why. Ultimately, the strength and length of muscles is determined by our brain. The brain receives signals from nerve sensors in the muscles that tell the brain about the load and the length of the muscle. The brain then sends signals back to the muscle to maintain proper strength and length. But if those nerve sensors in the muscles have been disrupted through injury or postural stress or repetitive motion, then the signal from the muscle to the brain is an incorrect signal, and the signal from the brain back to the muscle is also incorrect, maintaining the weakness or contraction of the muscle. So how do we fix this? We use a remarkable system of treatment named Trigenics in order to balance muscle patterns. Trigenics was developed by Dr. Olo Austin. He's a chiropractor, and he developed it initially treating elite high-level athletes very effectively. You can Google Trigenics and go to Dr. Austin's Facebook page, and you'll see some excellent videos there. We're one of the few offices in Colorado that uses Trigenics, and I'll demonstrate now how we use Trigenics to strengthen a muscle that is weak. All right, so this is Jennifer, my lovely front desk assistant. First, I'll demonstrate how we go about testing the strength of a muscle, in this case, the middle deltoid. So hold your arm straight out to the side. I'm going to push down and you resist. So this is real time, that muscle is actually weak. So now I'll demonstrate the Trigenics procedure for activating the middle deltoid. To do that, I'm going to use this therapy tool. It's named the Rapid Release 2 therapy unit. Hold the arm out to the side, bend at the elbow. When I say go, what I want you to do is push your arm down towards the table. I'm going to lightly resist that movement. At the same time, I'm going to work on the muscle belly of the middle deltoid. Push down. Push all the way down. Push. And a few more times. Push down. Push down. Push down. Push down. Very good. So that is a Trigenics treatment for the middle deltoid. Now let's retest the muscle to see if there's a change. Arm out to the side. I'm going to push and you resist. Very good. So that muscle now turned on. What we did is we reset the circuit of communication between the muscle and the brain. So now the brain is sending the correct signal back to the muscle, and the muscle is strong. There's also a similar procedure we use to lengthen a muscle. It's called Trigenics lengthening. What I just showed you is called Trigenics strengthening. Now here's a very important point. When we evaluate your shoulder, it's critical that we evaluate the entire kinetic chain, because your body works as one integrated whole. Structurally, that refers to the kinetic chain. There are 4 pairs of weight-bearing joints that allow us to stand upright in gravity: ankles, knees, pelvis or hips, and the shoulders. If any one of these joints is not functioning properly, it affects the other joints in this kinetic chain. So if you have a shoulder problem, we can't just look at your shoulder. We have to look at the other parts of the kinetic chain to determine other dysfunctions that may be a part of your shoulder problem. Let me give you a simple example. As I'm sitting here, I'm sitting upright. My lower spine is curved forward, my shoulders are back, and my head is up. In this position, when I raise my arms, I have full range of motion in my shoulders. I can go to 180 degrees. Now, let's say that I slouch when I sit, so now my pelvis is rotating in the backward direction. My shoulders are down and my head is down. When I try to use my shoulders, I can only go to about 100 degrees, and if I try to go beyond that, it creates excessive strain on the rotator cuff. So if I was performing work day after day, hour after hour in this position, that would create abnormal stress and strain on the shoulder joint, would eventually lead to inflammation, pain, and degeneration of the shoulder joint structures. So this is a simple example of how a shift in one part of the chain affects the other chain, including the shoulders. So when we evaluate you for your shoulder, we have to evaluate your entire structure. We have to view you and treat you as a whole person. So I've enjoyed sharing this information with you. I look forward to meeting you, assessing your shoulder, and helping to correct your shoulder condition.